It hits you like a ton of bricks the moment when you hear the words, "It's a brain tumor." Hi, I'm Janet Fanaki, patient and care partner advisor with WeTrials. Welcome to another episode of the Caregiver Chronicles, where I share advice to help you as a care partner to a loved one living with a brain tumor. As a former care partner to my husband Adam, who was diagnosed with glioblastoma, an aggressive form of brain cancer, I can personally say that getting that diagnosis changed everything for us. Everything. Adam was alone when he was told, and then he shared the news with me on my drive down to the hospital to see him. We were both gutted, sobbing, and perplexed at how a healthy guy could get something so serious and be told that he only had a short amount of time to live. As much as we didn't want to believe that it was true, we knew that we couldn't run and hide from the news. The scan showed what it did, and the doctors were sure. We needed to accept it and face it head on. If you've been given a brain tumor diagnosis, as well as a prognosis of what the treatment plan will be, here are some things to think about. 1. Take time to process the news. Getting a brain tumor diagnosis is hard to wrap your head around. Take the time to process it. Cry, scream, and let it out. Then start learning about the type of brain tumor your loved one has. Do your own research by visiting reputable websites like WeTrials and brain tumor organizations that can offer the right education and support. 2. Choose your medical team. When the patient is in hospital, they'll likely either meet a neurosurgeon or neuro-oncologist who will take them on or be referred to one. My advice is to do your own research. The day after Adam's diagnosis, we began contacting every person we knew who worked in healthcare. We asked them if they knew anyone in neurosurgery or neuro-oncology, their opinions, and then we moved forward with referrals to meet with them. We did this because we wanted to gather suggestions for different treatments and assess our compatibility to one another. Was the doctor a good listener? Did they explain things well, etc.? The soft skills for us were just as important as their expertise. Take the time to find the best team for you. 3. Ask questions. Once you choose your oncology team, be sure to ask as many questions as possible about treatment options and clinical trials. Do research ahead of time and go into your appointment with a binder or notes on your cell phone to help keep you focused, organized, and keeping questions succinct. Be sure to ask about support outside of clinic appointments. 4. Friends and family. Patients, caregivers, and your families are there to support one another, but you also need others to lean on and turn to. As a caregiver, you'll quickly realize you now are mission control and answering all the queries from everyone who finds out about this diagnosis. It's exhausting. Have your own friends to talk to, go out with, and encourage the patient and your families to do the same. 5. Connect with brain tumor organizations and professional support. Find the brain tumor organization in your country to receive education, support, and information from a body that understands your situation, can offer peer-to-peer support, and authorize resources for you in your journey. I joined caregiver support groups, private therapy, even made friendships through all of these organizations. Finally, don't close yourself off from others. You'll need the emotional and helpful support from neighbors, friends, colleagues, and parents to your children's friends. They can all offer help in the form of babysitting, dog walks, meal drop-offs, and an empathetic listening ear. WeTrials offers simplified access to clinical trials powered by AI, caregiver and patient resources, and support. Go to WeTrials.com to register for the app, where you'll have lots of information in the palm of your hand. Thanks for watching the Caregiver Chronicles. The next episode will be making the most of your clinic appointments. You're not alone in your journey. WeTrials is here for you. See you next time.